Hi, everyone. Thank you for joining this presentation today, Reimagining Prevention Using a Community Lens. If you are joining us live, please feel free to interact in the chat with our presenters, ask questions. I know that we'll have some time at the end to address some questions in the chat as well. And then you can also explore some of the files the presenters have left in the file section to the right of your screen. Today, we will hear from two organizations that have applied principles of equity, empowerment, and cultural sensitivity to tailor gun violence prevention programming to the specific needs of their communities, including needs that arose due to the COVID-19 pandemic effects.
Hi, and welcome to our presentation. We are the Urban Advocate, and I have my team with me. My name is Demisha Luster, and you will also hear from Dr. Ebony Haynes and Talania Thomas Smith. Our presentation today will talk about our work in Southwest Atlanta. It is called For Us by Us, one organization's work to reclaim their community. About the Urban Advocate. So, the Urban Advocate was founded in 2015 by local community members. I was doing some work in West Atlanta and I was coined the Urban Advocate. And that turned into a whole organization who developed its own arms and legs. Our current project that we're going to be discussing today is Guns Down Mechanicsville, which started in 2017. The project serves to alleviate gun related violence and provide trauma response in Atlanta's neighborhood planning unit V communities. Our specific presentation today speaks to one of those communities, Mechanicsville, and this project was seeded by grant funding from the Stadium Neighborhoods Community Trust Fund. Mechanicsville is just one of 6 communities located in Atlanta's Neighborhood Planning Unit V. It is a community that is located around Old Turner Field, and it is a very historic community. It's referred to often as a weed and seed community. Our community has an increased level of gun-related violence and trauma, particularly in the summertime. And that's where this project was developed from. One summer, about 3 years ago, we had 17 shootings, and they were impacting and concentrated around our Dunbar Recreation Complex, which is located on the map where you see the Rosa Burney Park. So that park is actually a recreation center, a sheltering arms early learning center, an elementary school, a pool, a tennis court, and 2 playgrounds and a football field that hosts our community football program. So in 2015, in NPUV, most of our reported crimes are violent compared to 16.8% citywide, and that is a huge jump. So Mechanicsville is considered a crime hotspot, and particularly around the Rosa L. Burney Park. So Guns Down Mechanicsville came from a grant called Stand Our Community, Our Voice that is funded by trust fund money from the sale of Old Turner Field. So it's money that was advocated for by our communities, and our projects are funded based on the needs of our communities and voted on by our community board. The project aimed to provide a safe space for Mechanicsville residents to share their stories related to gun-related violence and trauma. And again, this started before COVID, so we've had to make some COVID adjustments. Thankfully, we have been able to achieve our goals. And so we were hoping to engage 10 to 15 residents to tell their stories of gun-related violence and trauma via photo voice. We had to make a little adjustment just because of the social distancing rule. Explore adverse childhood experiences, and we're super excited to share our preliminary data regarding ACEs and inform our gun violence prevention mural through storytelling, which is a really cool project that we will be starting this upcoming September.
And so I will be continuing our conversation on the preliminary data that we've collected from our community survey. And actually, that community survey is still very much active. And we want to share some preliminary data here to help describe the community as well as the needs that we have identified so far. In terms of the individuals who completed the survey, we found that the average number of years that they've lived in the Mechanicsville community has been about 10 years. The majority of the respondents to the survey identified as Black, and we also had 6% who identified as Hispanic and Latino. Interestingly, in terms of education in this community, the respondents to the survey were about 33% of them either had a high school diploma or equivalent, or they were not high school graduates. And that is higher than we see in other communities across the country. So we thought it was interesting to point that out. Also, in terms of income, our residents in this particular community have have lower income than the national average. So about 33% of the residents reported income under $25,000. And also the unemployment rate is higher than the national average, even when taking into consideration COVID and its effects on the economy. In the Mechanicsville community, 18% of the individuals who responded to the survey question indicated that they were unemployed. Also, it's important to note how community trauma impacts our local community. And so we were interested in understanding the community members' experiences with trauma and violence in the community. And so we looked at past trauma using the adverse childhood experiences measures, as well as experience with violence while one had lived in Mechanicsville. And so for those of you who aren't familiar with this, adverse childhood experiences are exposures to trauma before one turns age 18. And the research literature shows that being exposed to 4 or more adverse childhood experiences, or what we call ACEs, has been found to be a predictor of a number of poor outcomes, including poor health, violence exposure and perpetration later in life, disability, as well as early death. So what we found in this study was that at least the preliminary findings indicate that there were about 33% of the respondents to this survey who indicated that they had 1 to 3 ACEs, which interestingly is lower than the national average of 61%. But in terms of the respondents who had more than 4 or more ACEs, 18% of respondents indicated that, which was right around the national average. It's also important to note, though, that we had about a quarter of the respondents who did not answer any of the ACEs related questions, although they did respond to questions that followed in the survey. And what this lets us know is that this data isn't missing at random. So some of our community members may not have felt comfortable answering those questions and exposing their past traumas, which may lead us to underestimating ACE exposures in Mechanicsville. So despite this, for those who did answer the ACE questions, we felt that it was interesting that the prevalence of ACEs within the community was still very high. And so the primary types of ACEs that our respondents were exposed to was quite illuminating. So the biggest exposures here in this community were that community members lived with someone who was a problem drinker, as well as they were emotionally abused as a child. So about a quarter of the respondents to the survey indicated that. And then we had some other exposures that are quite significant as well. So living with someone who's been to jail or prison, living with someone who was depressed, living with someone who used illegal drugs or prescription medication, and also living with parents who were separated. And it's also important for us to determine violence exposures by respondents, as well as those violence exposures among the people that they knew. And we know that exposure to community violence is linked to mental and physical health conditions, including things like PTSD and cardiovascular disease, also things like developmental disorders in children and sleep disorders. So in this study, we found that the primary types of violence respondents the respondents were exposed to were things like hearing gunfire. Next slide, please. Hearing gunfire, witnessing police use of excessive force, having their homes broken into, witnessing open drug sales, and seeing a dead person somewhere in the community were the primary types of violence. And we also found that the primary types of violence that the respondents knew were exposed to were things like hearing gunfire, being threatened by a gun, being shot, seeing a gang in the neighborhood, witnessed police use of excessive force, being threatened verbally, and also witnessing police use of excessive force. So the exposures to community violence in Mechanicsville are high. And they may also have long-term consequences to the residents as well as their children. The research literature is very clear about the impact that community violence has on communities. And our community residents, they were asked whether violence or crime was not a problem in the community, and a third of them disagreed with that statement. And they also felt like the COVID pandemic definitely had an impact on the level of crime in the community. So almost 2/3 of the community said that they perceived that crime levels had either increased or stayed the same since the COVID-19 pandemic started. And then when we think about residents feeling safe in the community during the day and night, we found that, about half of them indicated that they felt safe or mostly safe during the day as well as at night. But when we talked about, next slide, please. When we talk about their feelings of safety in the community, when they are walking day and night, we see bigger contrast. So we see about 60% saying that they strongly agreed or somewhat agreed that they felt safe during the day walking, but then this was reduced to 36% when they were asked about walking at night. The most frequent, we also asked the respondents to let us know what the community members could do or the leaders could do to make them feel safe in the community. And the most frequent responses were calls for police, community policing, or increased police responses. And also we saw additional responses, including things like suggestions for activities in the community for the children, changes to the built environment, and traffic calming, things like speed bumps or traffic circles, as well as calls for a collective community response to community problems. And Talania, I'll turn it over to you.
Okay, thank you so much, Dr. Haynes, for showcasing our data. What I will do next is lead us into our conclusion. As Dr. Haynes shared about the feelings of safety in the community, we had open-ended questions that our survey respondents responded to. And you can see here a mix of those responses to things that could make our community safer. So our goal is to continue collecting survey responses and conducting interviews until November 2021. The quantitative and qualitative data collected will be used to support and inform future projects and areas of research. Our preliminary data really has some interesting takeaways. As was shared earlier, 30% of respondents disagreed with the statement, violence or crime is not a problem in the community. However, 27% of our respondents agreed with that statement. They thought that violence or crime wasn't a problem in the community. And so those percentages, 27% and 30%, are fairly close, but those are opposing perspectives regarding violence in the community. We also asked about violence perpetrated by the respondent or someone else they knew. And interestingly enough, very few respondents indicated that they themselves had perpetrated a violent act, but respondents did seem more likely to indicate that someone they knew was the perpetrator. Of those people, they indicated that they knew someone who had threatened someone verbally, stabbed someone, beaten someone up, sexually assaulted, molested or raped someone, or burned or scalded someone on purpose. So as we continue collecting data, it's possible that we may see a certain connection between perspectives and perceptions on violence, whether violence is or is not a problem in the community, and that violence perpetrated by a friend or someone else that they knew. We'll also continue to survey and conduct interviews as we hope to increase the number of respondents and community buy-in for a safer community. And additionally, we hope to increase programming capacity for healing circles and trauma response, as well as secure funding for the next phases of gun-related violence prevention and trauma response in MPUV. Okay, and as always, we will be utilizing our data to inform our next steps and future areas of research. So thank you so much. If you would like to learn more and find out more, please, please, please keep in contact with us. You can find us online at www.theurbanadvocate.org and follow us on social media at the Urban Advocate ATL. Thank you so much.
Thank you to the Urban Advocate and to all of our presenters. I know storytelling is such a powerful way to uplift voices in the community, and we're all very excited to see the final results and just ongoing outcomes in Mechanicsville, and wish you all luck as you keep moving forward with this project. Thank you to everyone for your participation and your listening ears. And please remember that our presenters will stick around for a few minutes here in the chat, and you're welcome to continue asking questions. And they will be around to respond. And please also remember to explore their files and other resources that they've left for you, or any contact information or websites that they've left for you. And we hope you all enjoy the rest of the conference. Thank you.